Good morning everyone, I hope that you all had a great weekend. Are you sitting comfortably? Then let me present our patient. Marla Ormsted is a 7-month-old girl who was brought to her GP by her mother, Angela. She looked tired, grizzly and was rubbing her eyes. Her mother reported that Marla had a temperature. Her mother was concerned as the temperature was not getting any better. She normally uses homeopathy and oils to treat her daughter's illnesses. Marla's file was reviewed. Her birth and past medical history were unremarkable. She is growing and developing normally. Her mother manages a shop, whilst her father is a journalist and he had recently had a cough. She has no siblings. Marla had her primary course of diphtheria, tetanus, whooping cough and HIV immunizations. Her mother had declined pneumococcal and meningitis C vaccinations as she didn't want to overload her immune system. Marla was examined. She looked pink and well perfused, though a little grumpy. She had a slightly elevated temperature at 37.5 degrees but was not tachycardic or in respiratory distress. Her abdomen was soft and non-tender. Her fontanelle was open but not bulging. Her throat looked a little red but there was no exudate. Her tympanic membranes were normal. Her cervical lymph nodes could not be felt due to her chubby neck. It was felt that there was nothing wrong with Marla beyond a viral infection. Her mother was advised to keep an eye on her daughter and come back immediately if she started to vomit, stop feeding or become floppy. Remember, a floppy child is a sick child. Marla's mother was asked to come back on Saturday morning with a urine sample to rule out a urinary tract infection. Overnight, Marla vomited, refused to feed and her temperature went up. When Marla's mother finally got her to sleep, she decided to miss the appointment with Dr. Evans and allow her daughter to rest. By lunchtime, when Marla is roused, she looks more unwell. Her mother contacts NHS Direct and is advised to take her to accident and emergency immediately. She and her husband rush straight there. Marla was taken straight to the pediatric resuscitation room and Dr. Benjamin, the pediatric registrar, was called. An intravenous line was inserted. Marla was assessed. She was listless but still looking around. Her temperature had risen to 39 degrees. She was hemodynamically unstable with rapid pulse and respiratory rates and a low blood pressure of 90/60. Her Capri-fill time was 3 seconds. Marla was big, sick. Dr. Benjamin needs to identify the cause of Marla's infection and collects blood and urine samples and takes a nasal swab. The blood sample is taken for a blood culture and full blood count and C-reactive protein analysis. Dr. Benjamin explains that they need to do a lumbar puncture and take a sample of the CSF to investigate for meningitis. Marla is started on a broad-spectrum antibiotic through an intravenous line. The tests showed that Marla had an acute bacterial meningitis, and Dr. Benjamin explained that she is glad that Mr. and Mrs. Ormsted brought their daughter in when they did. Marla was started on an antibiotic called ceftriaxone which, Dr. Benjamin explained, is known to work against the common organisms responsible for bacterial meningitis in children. Marla's parents were confused, as there had been no rash, and they wanted to know how they could tell if she is responding to the treatment, and if there was anything else they could do. Dr. Benjamin explained that they could put Marla on steroids, as these have been shown in studies to reduce the inflammation around the brain, and reduce the long-term complications such as deafness. Mrs. Ormsted is concerned, as she thinks that steroids are bad for the immune system, and this should be working as well as possible. Mr. Ormsted is not interested in study data, and just wants his daughter to get better as soon as possible. The next morning, Marla is much brighter, and is more like her normal self, and her parents are happier. Her blood tests are repeated to confirm the improvement. Marla is reviewed during the consultant ward round. The CSF grew streptococcus pneumoniae and the white blood cell count and C-reactive protein levels have fallen. The consultant explains that they have found the responsible organism, and the antibiotic that Marla is currently on is appropriate. The consultant explained that pneumococcal meningitis is much less common now, due to the vaccinations against the organism. Both parents looked at each other. Dr. Benjamin advises that prophylactic treatment is not required for Marla's parents, as they should have acquired immunity. The consultant advises that whilst Marla is doing well, she will need to stay in hospital for a few more days. The consultant arranges for an autoacoustic emissions test to be conducted. The case continues.